The humerus is the bone of the upper arm, connecting the shoulder to the elbow. At its proximal end, the head of the humerus is a large, rounded, and smooth surface that articulates with the glenoid cavity of the scapula, forming the shoulder joint, known as the glenohumeral joint. Just below the head is the anatomical neck, a slight constriction marking the site of the growth plate. Lateral to the head, there is a prominent projection called the greater tubercle, which serves as the attachment site for three rotator cuff muscles: the supraspinatus, infraspinatus, and teres minor. Anteriorly, the smaller lesser tubercle provides attachment for the subscapularis muscle, another part of the rotator cuff. Between the greater and lesser tubercles lies the intertubercular sulcus, also known as the bicipital groove, a groove through which the tendon of the long head of the biceps brachii muscle runs. Below the tubercles, the surgical neck marks a narrow region that is commonly fractured. Along the shaft, or body, of the humerus, there is a roughened area on the lateral side called the deltoid tuberosity, where the deltoid muscle attaches. On the posterior surface, the radial groove, also called the spiral groove, runs obliquely, accommodating the radial nerve and the deep brachial artery. At the distal end of the humerus, the medial epicondyle is a prominent projection on the medial side that serves as the origin for the muscles of the anterior forearm, known as the flexors. This structure also protects the ulnar nerve, which is commonly referred to as the funny bone. On the lateral side, the smaller lateral epicondyle provides attachment for the muscles of the posterior forearm, or extensors. The trochlea is a spool-shaped structure on the medial side of the distal humerus that articulates with the trochlear notch of the ulna, while the capitulum, a round ball-like structure on the lateral side, articulates with the head of the radius. Above the trochlea on the anterior side is the coronoid fossa, a depression that accommodates the coronoid process of the ulna during elbow flexion. Just above the capitulum is the radial fossa, a smaller depression that receives the head of the radius when the elbow is flexed. On the posterior side of the humerus, the olecranon fossa is a large depression that accommodates the olecranon of the ulna when the elbow is extended.